This is Dr. Mandy Kirk from Move to Success Physical Therapy. So today's video is discussing the different types of hands-on manual work that can be done in a physical therapy clinic. So this is just touching base on a few of the different options and things that I personally like to do with my patients. So the first one is soft tissue massage. Soft tissue massage is just basically what you think of when you think of a massage. It's manipulating the soft tissue, and it's usually a good starting point for people, and it's a good thing for me to do to get a feel for what's going on underneath the surface. This is like that feel-good massage that you think of when you think of a massage. I typically tend to do more of trigger point release. So trigger point release is pushing down on an area, usually with my thumb or my knuckle, sometimes with the hard part of my palm, and then going through the soft tissue into more of that muscle belly, finding the areas that are tight, and then pushing down until I get a release. So it tends to be anywhere between 30 seconds and 2 minutes that I'll do a trigger point release, and people might be like, oh, that's uncomfortable at the beginning, but as that muscle starts to release, then they'll feel more and more relief until I slowly pull my finger up from that spot. Another type of manual hands-on work that I do is called myofascial release. So myofascial release targets the fascia surrounding the muscle, and so it's more of a soft pressure. It's almost to the point where people will say they don't really feel that much is happening, but it's a soft pressure for a prolonged period of time. So sometimes I'll do a cross hand technique, or other times I'll do like a smaller surface I can do with fingers. And as the fascia starts to release, I'll move my hands a little bit to move to where the fascia is moving. So fascia surrounds the muscle, and it's more of a sticky substance, like a saran wrap type substance that surrounds the muscle, and it kind of gets a little tangled or wound together. So doing a nice fascial release can be really helpful, because a lot of times we focus on the muscle, the bone, the skin. We don't focus on that fascial surface. So those are some of the big ones that I like to do. There's also like a cross friction, cross pressure technique that is done, and it's better for like a tendon or a ligament. So I'll go perpendicular to that and rub back and forth. It breaks up some of the adhesions. That one's also really good for scar. So like a scar tissue massage to break up the adhesions that are around like a specific scar. And that's really good for post-op, like after surgery, or for moms, sometimes I'll do it on a C-section scar so that you don't have that tightness there. And so sometimes I'll even do that one like harder pressure, or I'll use tools for that. So I have over here more of like a Graston tool that's metal, or I'll use gua sha tools that are like more like a stone. I can show you. So these are some of the gua sha style tools that I'll go across that tendon or ligament area to break up some of those adhesions. I also like to do cupping on people, myofascial cupping. So I have a couple different types of cups that you might see in a typical physical therapy clinic as well. So these are like the vacuum cups. So I suction the cup in and then pull this button to release the cup, and you can use that with oil or with lotion or on dry skin. And you can do a static cupping, which is you hold the cup, you keep the cup there for anywhere between 20 seconds and a couple minutes. Same thing with these. These are like a rubber style cup that you can put on Or you can do a dynamic cupping, so have the patient move while they're being cupped. So if I'm cupping like the bicep, I could have them do like an active bicep movement while they have the cup on. Sometimes they get a greater release with that. Those are the main types of manual work or hands-on work that I do with patients. Sometimes I'll also do a PNF pattern, or have a person hold in one position and push them a bunch of different directions, or have them resist me as I'm putting them through a range of motion. I like to do that as well for people who have like a frozen shoulder or have a lack of range of motion. So if you have any questions, feel free to comment below and like and subscribe. Thank you.